Hello.
Okay.
Yeah,
Uh,
hello.
Hi. Welcome to the International Medical Association. We are very happy today to have our dear doctors, the instructors of the invasive and non-invasive genetic genital aesthetics. We would like to welcome Dr. David Serafin, Dr. Khaled Osman, Dr. Mitra Bahminbour, Dr. Dedem Kurban, and Dr. Laila Khalili will be joining us soon, along with the rest of our instructors. We are not going to take much time. I know you are all have your own business and your own, business. So I think we are going to start with Dr. David Serafin. He will be introducing his topics and introducing himself to our audience. You can go. Thank you, Dr. David.
Thank you very much. Now probably you want me to share the screen, right?
Yeah, yes, please do.
Hello, everyone. I can see that we have still growing number of our participants, and today we are starting a wonderful course that will be in the future held for and with wonderful speakers. And that what I would like to say during my presentation, I would like to make a small mini review of aesthetic gynecology and leading gynecology associations. As you know, on the world, we have plenty of different associations. There are European Society of Aesthetic Gynecology. There is an International Society of Cosmetogynecology in the United States. We have plenty national association like Spanish Association, Polish Association. All of these wonderful associations, people who are taking part in great presentations, congresses, they are trying to refer their knowledge and show the experience of their work. I would like to introduce myself. My name is David Serafin. I'm a plastic gynecologist. I'm the international speaker of aesthetic and regenerative medicine. I am one of the member crew of scientific committee in international association, which is called IACSO. I was invited as international member of Spanish Association, also as ISGAR. I am a senior member of ISAC. Well, my adventure with plastic and aesthetic gynecology has started with hyaluronic acid, and that's why I will be speaking a little bit more during the Congress, during the course about the hyaluronic acid. But that will not be only one topic that I would like to explain and speak with you. That's why I'm the Nuvia International Trainer. I've created plenty of protocols in aesthetic gynecology with hyaluronic acid. I was invited by Alma company, and they offered me to be the family international trainer. So in my courses, I will be speaking a little bit more about the CO2 lasers and combination with hyaluronic acid, and I'll try to give you some protocols how to treat the patients with the hyaluronic acid and CO2 laser. I'm also the practitioner, so I do a lot of invasive procedures. I'm the author of labiaplasty technique, which is called the wedge, and this technique got the first award in International Society Congress of World Congress in Aesthetic Gynecology in States. That was a big award for me for best labiaplasty and hodoplasty, and I would like to explain you some more about this. Last year, I got the award for the best reconstruction and botched labiaplasty, and this year, once again, second time in the row, I got again Best Reconstruction and After Botchlebeplasty Award in States in 2021. Unfortunately, I couldn't be there because of pandemia and I wasn't able to fly. So first, when we are explaining the procedures during the courses, we have to know what are the diseases, what kind of issues have our patients. So it means how to help our patients. We have to know how to speak with the patients, what kind of questions we have to have in our heads to ask them, because usually aesthetic gynecology, it's not very common topic. It's still in a lot of cultures, it's a topic of taboo. So this is our role, and this is our point of view, how we want to help our patients, how we want to speak with them. So this is what I want to also talk with you during the Congress, to explain how to easily make connection with our patients and how to find the road to recognize the main problems of aesthetic gynecology. But this is not the end of my course, my part in this wonderful course. I will try to explain you what's the differences between non-invasive and invasive procedures. Some of us don't really recognize the differences between those two, when and where we can offer to our patients, when we can inject, when we can use only the RF treatment, which is non-invasive. And there is plenty of topics that we have to speak about it and to explain doctors who wants to upload their knowledge and to get more informations about different types of treatment. The main topic of my presentation will be hyaluronic acid, and I will be explaining you what is it, what's the hyaluronic acid, when we can use it, how we can use it, what kind of procedures we can offer to our patients, when we can use hyaluronic acid, and when we have to offer to women invasive procedures like surgery or reconstructive plastic surgeries. And it sometimes is really hard to make the choice. And what is really important for doctors who are using usually knife in their practice, so they do a lot of surgeries, maybe they will find the way to use also hyaluronic acid instead of scalpel. Of course, I will be showing you a lot of before and after effects, because that's the easiest way to learn how to make the procedures, how to perform treatments, what we can achieve, how we have to inject, where we have to inject, what are the indications, what are the contraindications, and so everything what you have to know in the beginning of learning of plastic gynecology. I wouldn't be myself if I wouldn't say something more about surgical aesthetics, because that's the huge part of my daily work, because I do surgeries every day. Today I came especially for you guys from Warsaw. It's like 4 hours drive, because yesterday I had a few surgeries in Warsaw because I was asked to do treatments there also, and today I had some consultations, and I took a road to came home and give you this introduction to our course. And at the end, I will give you some tips and tricks how to become a plastic gynecologist, and what's the easiest road to achieve a success in this very narrow part of gynecology, which is called plastic gynecology. I will try to explain you what kind of trainings you should choose, what's the steps of training, what's the good idea to take as the beginning of a training, and what we have to move a little bit in the time to learn about it a bit later. So everything what I learned for those years, I would like to explain you and show not only my experience, but also my mistakes in bad choices. And I hope everything what I will explain and tell you during the course will be helpful for you and useful, and I hope you will enjoy it. So if you didn't register yet, you have to do it, and we'll see soon. Thank you so much.
Thank you so much, Dr. David. That was so informative. We appreciate being with us today. So we are looking forward to meet you again during the course. Thank you so much. And now we are going to introduce Dr. Mitra. She will be with us right now. Thank you so much. Dr. Mitra, can you hear us?
Yes, I hear you.
Okay. You have the mic now.
Okay.
Dr. Mitra, can you hear us?
Hi, everybody. Good afternoon. I hope you are well and safe everywhere in the world. I'm Dr. Mitra Bahmanpur, having completed my education in medicine from Tehran University and post-graduation in obstetric and gynecology from Tehran University as well. Assistant Professor, Department of Gynecology at IUMS, founder and president of Female Cosmetic Capital, member of International Association of Stem Cell and Regenerative Medicine, faculty and consultant of gynecology line of general projects. I have been practicing under various departments in OBGYN for over 15 years, which especially last 7 years dedicated for cosmetic gynecology in Iran, through which I gained hands-on knowledge and experience in the complicated world of human beings and their sexual health, inspired by the richness of healthy lifestyle and driven by a passion for my work. I worked hard to establish my own center in Tehran. Now my successful center is starting a whole new medical field in cosmetic gynecology, which will include medical treatment for problems faced by women at different ages, aimed at enhancing their external beauty and appearance, as well as sexual wellness and also a better function. The center included dedicated for cosmetic gynecology, sexual medicine, and plastic genital surgery. I have also made sure that my center is equipped with the latest in technology to enable fat grafting, nano-fat grafting, microfat, BMAC therapy, besides other stem cell therapies for helping labiaplasty, orgasmic dysfunction and disorders, and anti-aging treatments as an essential component of cosmetic gynecology as well. I am proud of myself that I have had the most number of genital cosmetic operation in my country. Consumed stem cell for internal vaginal area, clitoral complex as well, besides other operations, so that I obtained invaluable consequences through carrying out a plenty of operations. I live in a populated country, and with help of that, I do plenty of cosmetic genital operations with help of combination of many stem cell helps. It is obvious that according to the population age is increasing, so that life expectancy is increasing as well. Based on the current trend, and as far as you have experienced and seen, you are more requested for better genital functions, rejuvenations, cosmetic changes by your patients. Therefore, you as a doctor need to be more up to date and catch up with the new methods. To your best, it is interesting that I worked hard day and night to achieve my goal and get a great deal of priceless experience, which I feel like sharing with my colleagues. In this course, that I am interested in giving you either my invaluable experiences or varieties of combination method with, that is my lecture about nanofat, fat grafting, and microfat, and use of carboxytherapy as stem cell therapy and rejuvenation methods with new methods give you brilliant consequences. Hope this course that is organized between 27th till 31st of May helps you to have more influence. Thank you for your attention.
Thank you so much, Dr. Mitra. It was nice to have you along with us today. We know you were busy, and we really appreciate your presence here today. We are looking forward to meet you on our course. Thank you so much. And now we are going to introduce our third instructor for today, Dr. Khaled Othman. Dr. Khaled, can you hear us?
Yeah, I can hear you, dear.
Okay, now you can have the mic.
Good evening, everybody. Hope that all of you are safe. I'm very happy to be with you today. My name is Dr. Khaled Othman. I'm a consultant in dermatology and aesthetic medicine. I already have an PhD in andrology. This is what my first from Cairo. After that, I have American Board of Sexology from Maimonides University. That's why I'm interested in aesthetic gynecology. Then I have the American Board of Aesthetic Medicine from California. After that, I have a laser fellowship from Harvard Medical School with Dr. Rox Anderson. That's why I'm really focusing more in laser, but in aesthetic medicine. Then I become the chairman of the Abu Dhabi International Derma and Aesthetic Society conference meeting, AIDA. And I am now the president of the Middle East branch of the International Society of Cosmetic Surgery, as well as the president of the Middle East branch of the International Academy of Cosmetic Surgery. I am a scientific board member for the International Society of Stem and Regenerative Medicine. And also now I'm focusing in parts of aesthetic gynecology with aesthetic medicine and new technologies like using the Botox as well as laser modules, like using the stem cells in some of the procedures, mainly in aesthetic. I will focus with you in this course in the laser and energy-based device that have been used for aesthetic gynecology. You will understand the basics of the fundamentals that you can understand the real laser with the wavelengths, why you choose it and how you choose it, and which wavelengths you can choose for which focusing or which aim you are looking for. Is it just resurfacing or tightening, or just it is a whitening, or ablative, non-ablative? What kind of laser you can use, even for tightening the stretch mark, for the using to as a hair removal, as a general idea, but mainly in aesthetic, because all these are considered in aesthetic gynecology. Even I tell my patients that you have to treat the area as if you are treating the face. So also I'm using the dermabrasion, I'm using the microneedling, I'm using all what you are used for skin as a skin, but in a preservative way, so that it not be painful. You can use it in this area so that it will look better and it will function better than it's going to be with aging. As you know that with aging there is many changes, so that we can reverse the age, as we say, and even we say a tightening or not an anti-aging as we say before, but we all reverse aging. How we can reverse aging again for this area, and of course after that for all the body as a body. What's the difference between the laser and other energy-based device? Why you choose this one? Like if you are using a laser, is it CO2 better or erbium better, or other kinds of laser? A radio frequency, a microneedling is better, or just only radio frequency laser device? The Thermeva and the idea of Thermeva, and I'm a friend of Reed Allenside, and we meet almost every meeting, and he is really a person that added a big value for aesthetic gynecology by introducing this device, as well as also introducing the Barbie valvoplasty. Also the using of endolift, or the internal radio frequency by invasive one, not non-invasive one. The threads can be used because I like the combined treatments. It is not only one device. The HIFU can be used internally and externally. So I'm concerning mainly about the devices. You will learn a lot about the devices can be used in this area by different technique, from the skin outside as an epidermis up to internally vaginally for different tightening, and what is the most safest and the most effective to be used in your practice. I'm practicing since '93. I hope that you will have an added value with me and other colleagues, and I will learn from my other colleagues, of course, because you have a pioneers in this specialty in this course, and I'm sure that you will learn what you will be an added value in your clinical practice with the future, so that you can have a more benefits for your patients itself, for what they are seeking from you. All the best, and see you soon. And I hope that I have the enough informations that I can give it to you. Thank you.
Thank you, Dr. Khaled. That was very informative. We are very happy, and it was our pleasure to have you with us today. Thank you so much. And now we are going to proceed our meeting with Dr. Didem Kurban from Turkey. Dr. Didem?
Hi, how are you?
Hi, you can have the mic now.
Okay. Dear all, let me introduce myself first. My name is Dr. Didem Kurban. I am cosmetic gynecologist and sexologist fellow by European Federation of Sexology. I was graduated from the medical faculty of Ankara University, and right after that, completed my specialist training in gynecology and obstetrics. I was involved in the non-surgical genital rejuvenation and in the master course aesthetic in genital surgery provided by ICAMS and European College of Aesthetic Medicine and Surgery. Then I became a fellow of European Committee of Sexual Medicine. Is someone's speaker on? I cannot hear my voice. Okay. Thank you. I was involved in the non-surgical genital rejuvenation and in the master course aesthetic genital surgery provided by ICAMS. I had a chance to work with world's most renowned experts in cosmetic gynecology area, and I became vice president of the International Society of Aesthetic Genital Surgery and Sexology. As an instructor, I gave international lectures, hands-on courses, workshops on aesthetic genital surgery, and have trained many doctors from all over the world. At the moment, I am the joint secretary of ISRM, and as well as I am instructor of IMA Society. Cosmetic gynecology is a new but quite a fast developing field in medicine. According to the European and American statistical inputs, it's the most evolving area among all of the aesthetic surgeries. People are living longer and longer, and they want to be attractive, we know, in their sexual life also. Parallel to incredible developments of internet technology, digital and social media, and also by lifestyle changes, many people tend to demand this kind of operations. What kind of operations do we perform? They can be divided into non-invasive part and invasive operations. As in non-invasive procedures, we do laser therapy, vaginal rejuvenation, stress urinary incontinence treatments, vulvar bleaching with laser, and we perform radiofrequency, HIFU, G-spotplasty, augmentation, genital PRP, genital fillers. As invasive operations, we do labiaplasty, labia majora reduction, labia majora augmentation, clitoral hydroplasty, surgical vaginoplasty, perineoplasty, and hymenoplasty. We know that there are discussions about genital aesthetic operations. We will talk about in this course about ACOG, FDA, and WHO recommendations, and we will discuss about women's expectations management, and we will learn to select the patient. These operations have been done not only for aesthetic purposes as genital beautification, but also have sexual, hygienic, psychological, social, and medical advantages. And aesthetic genital surgery can alleviate positive changes in their life and enhance their self-esteem. However, these procedures should be done only by trained hands. International Medical Association is aimed to give some courses for the doctors who are interested in cosmetic gynecology, introducing new relevant technologies, having collaborations with different national and international groups, and being active in this area to acquire more developments. I believe that sharing new ideas, modern treatment methods, and knowledge on scientific base will lead to improving this medical area so fast. And by the trained surgical hands and using appropriate techniques which meet the patient's expectancy well, we have fantastic results in appearance and function both. I hope to meet you in our courses and meetings. Thank you so much for your listening.
Hello. Thank you so much, Dr. Didem. It was very nice to have you today. Thank you for your information, and we are looking forward to meeting you in the course. And I'm sure that we are going to be very fruitful. I would like to
Yeah,
announce
thank you.
that our website is www.ima-edu.org. Again, it's www.ima-edu.org. This website will be your guideline for all the courses, including aesthetic gynecology, dermatology, nutrition, even more of the specialties. You can join our website and you can see all the information you want to know about the International Medical Association and also our upcoming events, including courses, online courses and live courses. Thank you so much, Dr. Didam. Now we are waiting
You're
for
welcome.
Dr. Agnieszka to join us. Please stay tuned. Thank you so much. Dr. Laila Khalili, can you hear me?
Yes, yes. Hello.
Hi. Okay. Dr. Agnieszka appeared to have some issue. She just want you to start if you are ready for now. Can we go now?
Yes.
Okay, that's perfect. You have the mic now.
Okay. Hello.
Yes, we can hear you.
Oh, thank you. Hello, guys. I'm Dr. Leila Khalili from Iran. I'm a gynecologist, but I do cosmetic gynecology from 2014. I be trained in the America with Red Allison. Cosmetic gynecology is the latest revolution in the aesthetic field that vastly growing in demand and popularity. The study showed that the rate of the labiaplasty increased more than 80 times from 2008. It changed female external genital appearance to look younger and more natural. It's using for reshaping in female genital area in order to increase pleasure, sensitivity, and aesthetic beauty of genitalia. Cosmetic gynecology procedure reconstruct exciting defect from giving birth and help improve self-confidence and acceptable from others. The important point is that a lot of people and doctors mistakenly believe that the cosmetic gynecology is only for cosmetic goals, but I would like to have your attention on this issue that it's not only for cosmetic issues, it's in many situations is for reconstructive and functional problem in genital area. In Iran, I did cosmetic gynecology for more than 6 years. We have some course in Iran that in this course we teach the step-by-step cosmetic gynecology. Cosmetic gynecology that anatomia, indication and contraindication in cosmetic surgery, that they are very important. labiaplasty, minor labiaplasty, major labiaplasty, using the filler injection, fat injection for the reshaping and for the treatment of some problems in genitalia, G-point or shot injection for increase the orgasm, and vaginoplasty, perineuraphy, and using the laser and RF for some problem, same as the vulvovaginal atrophia and for bleaching and tightening of vagina. And also we use the high flow carboxytherapy, PRP, and plasma gel injection for some treatment goals. And one of the most important things in cosmetic gynecology is that a lot of doctors they didn't trained with teachers in the world. So in Iran, a lot of doctors do surgery without any training. So we have a lot of bad results surgery in Iran. So I advise to doctors that they are new in cosmetic gynecology that be trained with doctors that they have experience in cosmetic gynecology. So after that they do surgery, because sometimes the result of surgery are very bad, and we need to do repairment surgery using flap and graft for the reconstruction of labiaplasty. Thank you, Dr. Rayana, for invitation of me.
Thank you so much, Dr. Laila.
Thank you.
Your information are very valuable, and we really appreciate so much your presence today. I know you were traveling and you made it to the webinar, so we really appreciate it. Thank you so much.
Thank you.
We will be looking forward to meeting you in the course.
Thank you.
And again, I would like to announce our website at www.ima-edu.org. You can find all courses, including aesthetic gynecology, dermatology, dentistry, and so many other medical specialties. Now we will be waiting. We will be with Dr. Agnieszka Nalwiczyliska with a second. Thank you again, Dr. Laila, and thank you soon. See you soon. Thank you.
Thank you.
Dr. Agnieszka, can you hear me?
Yes, I can hear you.
Okay.
Hello.
Hi. Thank you so much for being with us today. I know you are a little bit don't feel so well, but I really appreciate so much being with us today. And you have the mic now.
Okay, I'm sorry for my voice because I'm ill now, and this is the horrible time for all of us. I hope I'm not have COVID. I already have vaccinated, so hopefully, but my kids are also sick, and after this I'm sick as well, so sorry for my voice. I just wanted to connect and introduce myself. My name is Agnieszka Nalwiczyliska. I live and work in Warsaw. This is the capital of Poland. I'm a gynecologist, and in my field of interests are the basic, like laser, CO2 laser, PRP. I'm now finishing the study about the lichen sclerosis and the PRP treatment also. And I will be talk during this webinar about the threats. So I will try to recommend you all the threats in the non-invasive procedure, just to tight the vagina as well, to also improve the labia majora. So I hope you will be interested also and will be happy and pleased with this seminar. So please welcome, and I hope you will join us during this webinar.
Okay, thank you, Dr. Agnieszka. I know that you don't feel so well, so Yani, this is so appreciated of you to be with us today, and we can't really wait to see you in the course. I hope you will be fine soon, and I will pray God, and I'm sure actually it will not be COVID, inshallah. And inshallah everything is going to be okay. Thank you so much. And now,
so much. And I hope we'll see during the course. So
yeah,
all the
sure.
best for you.
Thank you. Now, our last but never the least, this is Professor Iman Sanad. She's the godmother of the International Medical Association, actually, and she helped a lot to to be one of the pioneer in the Middle East. As our website is we're growing, she gave us the push, and she gave us the most of her time and her power to be one of our pioneers and our founders. She couldn't be with us today, but she recorded a message for you. I hope you enjoy it, and I will leave you with the video within a second. Thank you so much.
everybody. It is my pleasure to introduce for you an introduction to female genital aging and anti-aging course. I am Professor Iman Sanad, Head of Department of Dermatology and Venereology, Benha Faculty of Medicine, Egypt, and also Head of Department of the International Medical Association. We have the pleasure to introduce for you great courses in the different specialties in medicine to increase your professionality and knowledge in practicing all the medical practices and to compensate with the new development of informations that's come every day when and then. Now we will introduce a small introduction or a short introduction about female genital aging and anti-aging, which is a well-developed aesthetic branch. Our webinar aims to reveal our course content and answers the important questions. Why should I attend the course and how much will I gain from it? All organs of the body, including genitalia, are subject to slow and gradual aging that leads to functional and structural changes. The natural causes of aging are mainly concentrated in the vaginal tract, which is subjected to a general atrophy. That's why we have to be highly interested in this precious area of the female body. Fluctuations in weight, pregnancy, and vaginal childbirth can all cause the muscles of the vaginal tract to stretch and weaken. The lack of estrogens impacts the whole woman's body. That's why the period of menopause is a very critical zone. We have to deal with it and not to leave the female burden this area, which is so critical for her body and also for her psychological status. Vaginal atrophy is one of the most bothersome symptoms of estrogens decreasing. During the aging process, the skin becomes less elastic and loses its natural collagen and fat. The labia become looser and more prone to droop with gravity. There is loss of vaginal tone, perineal muscular atrophy, vaginal dryness, vulvar itching and dyspareunia, stress incontinence, which is so distressing for any female, and also clitoral involution. Symptoms are likely to continue if left untreated. That's why we are together now, because we have to treat all these complaints and not leave them to bother the lady of the menopause area. Today, on average, a 50-year-old woman has biological age of 10 years younger. Why we don't interpret it also the vaginal area of this precious area to minimize the age and functionality of the female at this precious zone. Hot flashes, insomnia, mood changes, psychological implications of fertility loss, osteoporosis, weight gain, decreased libido, and difficulty in relationships for vaginal atrophy may affect the quality of life and the biopsychophysical balance. Genital aesthetic is a crucial upgrowing field these days, as it offers solutions to many problems regarding male and female genital wellness. Now, treatments that aim to improve the form and or function of the vagina are gaining recognition in the industry and among the public. And actually, the recognition and increasing the awareness of the population is also one of our important goals. We have to be present in the media together with increasing our professionality in practicing this specific subspecialty to introduce the benefits to the females at especially those at the age of menopause. We have several aesthetic medical solutions. As we all know, Estrogen-based treatments are effective, but many patients are reluctant to be treated due to health concerns. Estrogen replacement, we have a big concern about its possibility of producing cancers of this area, and also it can produce intermenstrual bleedings. We have several medical treatments in the form of regeneration with PRP or growth factors, filler, lipofilling, intravaginal laser, ultrasound, radiofrequency, or HIFU, and skin revitalization. Hyaluronic acid infiltration is able to provide a significant rejuvenation with a simple outpatient procedure. Hyaluronic acid can be injected either intravaginally to enhance vaginal mucosa G-spots and even can enhance clitoral hood. It also can be introduced subcutaneously to enhance the volume of the labia majora, especially for those who do bariatric operations and lose a big amount of their weight. Platelet-rich plasma, or PRP, used in sexual dysfunction is considered to be a revolutionary new non-surgical outpatient treatment that helps improve both urinary incontinence and sexual dysfunction through using a woman's own growth factors. The PRP is injected into specific areas of the vagina with the aid of local anesthetic cream. We just put a local anesthetic cream for about 30 minutes, and after that, we can inject the PRP. How we can obtain the PRP? We aspirate about 10 to 15 ml of peripheral venous blood in a vacutainer in special tubes that's specified for the use of PRP to enhance the validity of PRP. Otherwise, you will contain PPP or platelet-poor plasma with much more less results. The tube of containing the aspirated venous blood is put in a centrifuge in a special RPM and special time specified for the tubes used. After that, we can separate the PRP, and it is a very important advantage of the PRP that it can be injected in any area of the genital or the external genital tract. We can inject it in the labia majora, labia minora, most pubis, valvular vestibule, and posterior commissure of the labia majora, vaginal introitus, and perineum. What is the function of PRP? As we said, it is very rich in platelets, hence it is very rich in growth factors that help to revolute the genital area and return back by the normal functions to its youthful capacity. Hence, all the functions of the genital area can be retained for longer and longer periods of age. Lipofilling also is a very important maneuver that can be used by aspirating fat cells from areas rich in fat content in the patient's body. After that, we prepare it by certain steps, and we can add for the living cells, the living fat cells, we can add for it PRP to enhance the vitality of the fat cells, hence enhancing the validity of the fat cells to be living for longer and longer periods of time, and to supply the area where it is injected also by growth factors. Also, another mode of treatment is the use of heterologous biorevitalization. Here, we obtain the growth factors that are manufactured in certain labs and prepared in certain vials. And the most important advantage of heterologous biorevitalization is that the amount of growth factors is titrated to give us the optimum results after injection. Stimulating the vagina through injecting cocktails containing hyaluronic acid, resveratrol, glycerol, antioxidant agents, and nucleotide with stimulating action on the fibroblastic cells. The fibroblast is the master cell in the vaginal wall and in the skin that carry the function of producing the normal hyaluronic acid in our body and also producing the elastic fibers, which give the vagina the capacity of being dilated and returned back by the elastic recoil of these elastic fibers to its normal size, keeping the tightness of the vaginal wall. The collagen fibers also are very important to preserve the turgor of the vaginal wall and also of the external skin. Cocktails can be mixed with PRP, hence we can combine the validity and the advantages of both the biorevitalization that supply us with the immediate results and also the titrated amounts of the growth factors together with the PRP that can give us a larger volume to permeate all the vaginal wall with the platelet-rich plasma. Dark pigmentation of the genital area is a sensitive subject for many to talk about. This is a very distressing problem that to a great extent, sometimes the patient doesn't come to complain by this issue, but of course, for the gynecologists, they can observe this during the vaginal examination of any obstetric patient. It can be caused by aging, hormonal changes, can be genetic, or appear after giving. Safety in interpreting with this hyperpigmentation is a very, very, very important issue. That's why actually we are here with you to increase your knowledge about the causes of hyperpigmentation, the modes we can use to alleviate this hyperpigmentation, and how to practice these procedures in a safe mode. Otherwise, more hyperpigmentation can occur. Topical therapies in the form of hydroquinone, 4 to 6%, can be used together with tretinoin, kojic acid, arbutin, and topical corticosteroids. But actually, usually the patient uses these medications for longer and longer durations, and most probably they use it even without medical prescription. That's why they are so liable for obtaining side effects from these medications. This is a form of stria or stretch marks that can occur in the upper thighs due to the stretching and loss of the integrity of the skin, which commonly occur after prolonged use of topical corticosteroids. Chemical peels is a very important technique that actually we have all to learn about it. But at the same time, it is a highly risky technique because if we don't use it properly, of course, hyperpigmentation, sometimes chemical burns can occur at the highly sensitive area. Chemical peeling procedures involve the application of a caustic chemical agent to the skin, which produces a controlled. How to make a control? This is why we need knowledge and we need training. A controlled partial thickness injury, thereby promoting the growth of new skin with improved surface characteristics. After the skin peels, the new skin surface is lighter and smoother. The indication determines to a great extent the type and depth of peel necessary, because we have several types of peels. We have peels which is very superficial that can be used for mild cases and very sensitive skin, superficial peel that's used for thicker skin, medium peel, and deep peel. Actually, they are very rarely to be used in the genital areas because they are highly effective, but also highly risky. To know the differences between the different types of peel, we have to have knowledge and to have hands-on training. Genital aesthetics increasingly arouses interest among women and can significantly improve the appearance, comfort, and sexual satisfaction. Thank you for everybody, and I am here to be almost always in contact with all of you. Any query or any questions about any of our course or any of the information that is presented in this short introduction, most welcome to be answered. Will be almost always with you, and also the International Medical Association. We are anytime upon your service. Thank you.
That was the message of Dr. Iman Sanad. She again apologized a lot for not being here, and she really is waiting for your presence and your questions on all the course. She will be there to answer all your questions along with all our prestigious faculty. Thank you so much for being with us today. We are more than happy to host our panelists and our attendees. Again, if you have any question, you can join our website. It's www.ima-edu.org. Again, it's www.ima-edu.org. Everything you need, everything you're looking for, you will find it on our website, and in many of the medical specialties, and also so many different courses and webinars, conferences around the Middle East, in Egypt, in Dubai, in also we are planning to go to some other places like Europe and Turkey. We have also we are planning also to go so far into the east, and to reach out to Iran, to India, Pakistan, and this is will also be with you. I think we are having some questions. If there is anyone who would like to ask, please raise your hands. Okay, our first question is when the course. The course will be 5 days of online sessions between the 27th of May till the 31st of May, and along with two hands-on days. Hands-on training will be 2 days. It will be in Egypt, and also will be repeated in Dubai. The hands-on will be in mid of June. The date will be set soon. Yet, what we are sure about is the course between the 27th till the 31st of May, and we will be waiting for your participation. Yes, we are open to all our dear friends from the Middle East, from the Arab world. Of course, you are welcome to join the hands-on in Egypt, and also you are welcome to join the online course. Yes, we can share the website. It's www.ima-edu.org, and here is the message. Do we have any other question?
From international to everyone.
Hello, Dr. Inshad.
Hello.
Dr. Inshad? Okay, we have Dr. Ines. Dr. Ines? Dr. Ines? Dr. Ines, do you have any questions?
Hello.
Hi, Dr. Ines, we can hear you.
I would like to ask about the fee if we are only online. Can I know the fee?
Okay, Dr. Ines, just provide us with your WhatsApp number and all details regarding the fees and how you are, how you will be able to pay them through WhatsApp.
Thank you. Thank you.
You're welcome. Okay, do we have any other questions? Okay, we have Dr. Ines. Dr. Ines? Okay. Okay, thank you, Dr. Maitsoon. About Dr. Inshad, about the cost, please provide us with your contact, the WhatsApp number, and all details regarding the cost, how can you join, and the number of days in details, the program, everything will be available soon. As soon as you send us your contact. Regarding the topics, we have the invasive part. Dr. Didam Kurban will be our trainer for this part, and the non-invasive part, we will have the rest of our panelists for today, Dr. David Serafin, Dr. Khaled Othman, Dr. Iman Sanad, Dr. Mitra, Dr. Laila, and Dr. Muhammad Saad Hagazi, who were not able to join us today, and also Dr. Agnieszka. The titles will be announced soon. Please follow our Facebook page. It's International Medical Association, IMA, and you can find all the courses. About the how many hours per day the program will be announced in details very soon. As soon as we end this program, we will be creating the program, and we will share it on our social media. Again, our Facebook page is International Medical Association. You can search for it, or I can actually send you the link right away. Okay, thank you, Dr. Inshad. We will contact you as soon as possible. That's perfect. Do we have any other questions? Okay, thank you so much. We all were happy to host our panelists and also to have you all our attendees. Thank you so much. We will be waiting for you, and as always, you can contact us through our website or through our Facebook page. We also you also can contact us through our Facebook page of the event group. We also very happy to have you. We have our Facebook and Twitter and Instagram account at IMAE platform. You can find us anywhere on social media. Thank you so much and see you soon.